India today is home to millions living with diabetes. Biggest risk is the risk you don't know that you have it.
Generally, we call it as there are four different types or classification of diabetes. Number one is type 1 diabetes, which generally occurs in children or adolescents or age less than 35 years. It is around 5 to 10% of the total diabetes which occurs. Most common type is what we see generally is type 2 diabetes, which is caused by insulin resistance or the decreased action of the insulin which is required to be done, and that causes the insulin resistance syndrome and type 2 diabetes. This occurs around 90% of the people of generally patients we see in the OPD.
Diabetes is just one disease is actually a myth, which means so in reality diabetes is more like an umbrella. Different causes, different mechanisms, different treatments.
Yes.
And this is why self-diagnosis or copying someone else's treatment can be really dangerous.
Definitely. Genetic predisposition is the main cause because we have some chromosomes and genes which are protective for type 1 diabetes, and some are giving more prone for the type 1 diabetes, but not very hereditary as we call it, where it runs in the families. There is very less chance of running in the families, but we have some syndromes what we call as where all the kids of one family can have type 1 diabetes.
Wow.
And the complications of uncontrolled diabetes, as we all know, chances are more in type 1 diabetics, like microvascular disease, kidney disease, retinal disease. It's more in this type 1 diabetic patients.
Many people don't realize type 1 is an autoimmune condition. It is not related to lifestyle. Like typically diabetes is known as a lifestyle disease, but type 1 diabetes is actually, it has got nothing to do with life. So why it is important for patients to know which type of diabetes they are?
The diagnosis or type of the diabetes which is diagnosed by the doctor determines the therapy for the patient.
There is something called as 1.5, which is also LADA, as latent autoimmune diabetes in adults.
The name suggests 1.5 means it is in between type 1 diabetes and type 2 diabetes.
During COVID times, I think steroid was prescribed. It was highly used. Post-COVID, could you find any more changes?
COVID itself can cause diabetes in many people.
Okay.
The stress of that whole pandemic caused diabetes to many people.
We are adding for the first time a very fun element in this. The doctor behind the white coat, personally, honestly, and with a lot of fun.
As a clinician and as a person, to make the patient care possible is also 50% important as patient care.
Wow, that's a very important perspective, I think.
Every doctor says that his own practice should getting developed, and some newer developments should happen in his field by him, his clinic, and he should do something for the society also in a bigger way.
Right.
So
anything futuristic, be the first mover.
Yes.
Okay. What is that one thing you love most about being a doctor?
The most good thing, the best thing which we all doctors like is respect.